a visible panic over the rise in the cases of cardiac arrest and heart attacks that has now been reported at a Mysuru hospital. That has now been seeing long queues at the Jayadeva hospital, where there are queues for checkups. At least 400 plus patients who have been visiting the hospital almost on a daily basis. What is now being said that there has been a surge in the cases of heart attacks that have now been reported, and as precaution and checkups, what we are looking at, that the people there finally, in a way, Imran, are now starting to take care of themselves and precautionary measures there. But what explains, we have seen as far as in Hassan is now concerned, what's happening in Mysuru?
Well, the recent heart attacks we've seen in Hassan and other places has reporting of heart attacks has gone up, and even the report has come out linking no in terms of linkage with COVID vaccine to heart attacks. But they said the government also did a press conference and said that to increase general health factors and stop smoking and other issues will lead to heart attacks rise in 5 to 6%. Now there has been a lot of concern among people. Some are due to panic, some are due to proactive looking at their health, have started coming to hospitals and giving their long queues. What we see in Mysuru, people are coming up and doing tests. This is what we're getting to know, that more than 400 to 500 patients are coming. People are coming every day to do that cardiac test, and that has led to long queues at the hospitals there.
Right, but what exactly explains such kind of a surge? I mean, are the doctors there been reacting? Of course, we have seen the political blame game that has been happening. But what has now been said, especially when it comes to patients, Imran, with genuine health issues, are they facing any difficulties in getting timely treatment?
Well, yes, due to the rush, there are the people who generally have affected are getting, issues in that, because there's a long queue now. Suddenly there is a 400 to 500 patients coming every day. What the doctors have said is that lifestyle issues, other factors, obesity and all other smoking and tension is what leading to heart attacks, rise in heart attacks. And they say that the rise in heart attacks has been to 5 to 6% is what the study chairman of the Jayadeva hospital have informed us. So this is what they say, but there is a awareness, but also there is a panic among people to get their heart checkup, and this is causing to the genuine people who are coming to the hospital of heart disease, they'll also have to stand in long queues, because more than 400 to 500 people are turning up every day to do cardiac checkup. And this is one instance of Mysuru where the visuals are coming from.
All right, where an alarm that has been sounded on an average, what is being said that around 400 to 500 patients who are visiting the Jayadeva hospital every day, including many from other districts as well. Now that has created a challenging situation for the hospital staff in catering to the needs of several people, where you can see long queues are being witnessed outside the hospital for getting their medical checkups done. What is being said, at least 400 plus patients have been visiting the hospital every day, and this is a concern that has now been risen as far as rising cases of heart attacks that have been reported. And this is the rush that has now been visible in one of the hospitals there in Mysuru. Well, Imran continues to be with us, because this has been the state that has now been recorded. We've seen previous cases that was reported from Hassan, and speaking on the same issue, it was Chief Minister Siddaramaiah who had raised a concern, probably linking when it comes to the rise in cardiac arrest with the COVID vaccine side effect. However, it was completely denied, but there has been no linkages at all when it comes to COVID vaccines and how effective they are and how safe they are with, of course, when it comes to the rising cases of heart attacks that have been reported. Mainly lifestyle changes and dietary changes are said to be the possible reason. But now the people who have been facing serious ailments and heart-related issues as well seem to be getting affected in getting timely treatment, because there you can see the queues that are being witnessed outside the hospital there in Mysuru. People are being getting their timely medical checkups done.